As we mark 1 year since the coronavirus disease plagued the world, healthcare workers everywhere are experiencing some of the most turbulent times, not only physically, but mentally as well. As they try their best to help patients sick with COVID-19, they continue to risk their own health on a daily basis. Lakewood, California has emerged as a new hotspot for the virus, as healthcare workers do their best to respond to the huge influx of victims. Chapman reporter Bella Leach was able to talk to one of these healthcare workers, Ron Bautista, about what it's like working at the Lakewood Regional Medical Center during this tough time.
So how long have you been working at the convalescent home, and how has your job changed since the COVID outbreak?
I've been here for 3 years. It's honestly changed because we used to be long-term care, and so once COVID had started, we since I'm the smaller unit, we only have 24 beds. They readjusted our patients, so they moved out the 24 that we had, and then we were just admitting. So whenever they came from the hospital, they do the quarantine where I'm at. They were quarantining here for a bit, but then there were some cases popping up here and there throughout the facility, so they just made us red, and they made a different unit like yellow. So it goes red, yellow, green. Red means you're with COVID, and then if you are yellow, that means you're still quarantining some people, and then green means free. You have no cases at all. You don't have to quarantine anyone. That's where they're living. It's pretty. It's been pretty intense because it's psych slash medical, but more on behavior-ish.
So what has been the most difficult part about navigating the virus along with the rest of the world?
Just people following guidelines like wearing masks and just following the social distancing. Because even at work, like it's hard when I tell a resident they should be 6 feet apart from someone else. We try our best to keep them separated, but it's tough. And then just out in the world, people aren't listening. People don't really care until it really hits home for them.
So Erica told me that you got COVID from your job. So how did that impact how you care for those at the home?
When I was first positive, I wasn't allowed to work. So I had a quarantine for, I think it was a month. I was in my room for 30 days. And then the state of California said that I could just go back if I'm 3 days without any symptoms, and then I was able to go out. So I was in my room for approximately a month.
So in what ways do you think the virus will impact the future of your profession?
Be more keen to wearing masks. Even in a post-COVID world, probably still wearing masks. Probably myself as well.